All right. Hello, everyone, and welcome back to Live with Leslie. And today you are in for a incredible conversation with someone who's been shaping the future of women's health for more than 2 decades. And I'm so excited to welcome Dr. Jessica Drummond. And she is the founder and CEO of the Integrative Women's Health Institute and best-selling author of Outsmart Endometriosis. Jessica has a long list of credentials. She is a licensed physical therapist, a licensed clinical nutritionist, and board certified health coach who has supported thousands of women worldwide with complex pelvic pain, hormonal imbalance, and chronic pain conditions. And her professional training programs now reach practitioners. Are you sitting down? In more than 60 countries, which is such an accomplishment. And today we are talking all about the two-part formula for a future-proofed practice and why AI plus niche clarity is a non-negotiable. So if you've been kind of feeling the pace of change in women's health, if AI is starting to feel overwhelming, or if you're, kind of struggling to figure out your niche and narrow things down so your business can grow with ease, this conversation, I think, is definitely for you. It's going to give you clarity and direction. So let's go ahead and jump in, shall we, Jessica? I'm so excited to see you. Welcome.
Thank you so much, Leslie. It's my pleasure to be here and chatting with you.
Yes, so looking forward to it. Okay, so tell us, I think what would be a good place to start is, tell us a little bit about your background in training health practitioners. I know you've been doing this for years now. Um, yeah, can you just give us an overview in terms of your organization and what you're doing?
Yeah, I'm excited to share that the Integrative Women's Health Institute turns 20 in 2026. So we've been doing this for a long time. And it started from a place where back in the early 2000s, late 90s and early 2000s, I was working as a physical therapist in hospitals and clinical practices. And I pretty quickly specialized in women's health. So a lot of my most complex clients were people with chronic pelvic pain conditions like endometriosis, painful bladder syndrome, vulvodynia. And at the time, we our physical therapy tools were helpful, but they only went so far. And there was a lot of conversation around pain management. But if you've read or seen Dope Sick, you understand now that that conversation was really around giving people pain medications. And then many people became addicted to opioids and things like that. None of those tools were enough. Now there is a time and a place when pain medication is really appropriate. Physical therapy is still really valuable and appropriate in chronic pain conditions, but the surgeries have come a long way now. We know a lot more about integrating nutrition and functional nutrition, which was the conversation I started 20 years ago in chronic pain management, talking about the gut microbiome and the integration between the nervous system and the immune system and how that plays a role in chronic pain. And so what happened was we began to think more broadly and holistically about chronic conditions. And my career started in chronic pain. But because chronic pain in women's health is always integrated with things like hormones and menstrual cycle and pregnancy and postpartum, through the last 20 years, we've really evolved. And the area that we really focus on now is the intersection between perimenopause and menopause and chronic illness, because 87% of women in that like 35 to 55-year-old age group also have another chronic condition that can look like the symptoms of perimenopause and may be impacted by perimenopause, even if they were well controlled to that point.
Okay. So, all right. So, what would you say is different about, I don't know, 2026? How have things shifted? And why is this women's health movement so critical for business owners?
So, for practitioners and people looking to get into the field of women's health, or people who are currently working in women's health in a clinical role and are really feeling how our healthcare system is honestly crumbling. And it has been for quite some time, but there's a real acceleration in literally like closing of rural clinics, closing of rural hospitals. And so we have to, someone is going to rebuild these models. And I feel like that someone should be people who have clinical experience and expertise and commitment to excellence in the field of women's health. Now, there's a couple of good things happening. There's a huge conversation on social media and online around complex chronic conditions such as endometriosis and around perimenopause and menopause. The challenge with that is that women in general are becoming more knowledgeable about these issues. They're becoming more knowledgeable about whether or not they may fall into some of these categories. But there's still a dearth of healthcare resources for them to go to. And so some of our most successful graduates actually are people in like what I would consider like healthcare deserts in rural areas. And then you combine that with an underserved niche. So a lot, more and more women's health specialist physicians, say gynecologists, for example, and women's health nurse practitioners are being educated on some of the foundations around prescribing things like hormone therapies, which is great. And there are some ways to access that digitally, but they don't have the time with their patients consistently over months to years to then think about, well, this person didn't respond very well to estrogen. Well, let's just take them off it versus thinking, oh, could they have mast cell activation syndrome? And thus we need to lower the dose, or we need to manage the mast cell activation syndrome and then layer on estrogen. Or maybe we need to look at the ratio between progesterone and estrogen. So the questions are becoming more complicated in a system that has less and less and less time and is trying to be automated more and more by the people who own healthcare now are, people in private equity, not clinicians. So when clinicians step away and create practices where women can be heard, where they have a little bit more time with their professional, they're often willing to pay more and pay for that out of pocket because they get their answers quicker and more efficiently. They don't have to go on what my friend Isa Herrera calls the doctor to doctor roadshow. Like they don't have to spend a year and dozens of copays, which end up costing the same amount of money to them when they are then working with practitioners or teams of integrative practitioners who really slow it down and have that level of expertise to fine tune the more complexities. So I think there's a real opportunity to give better healthcare. The practitioner actually makes more money instead of private equity making more money, and the patient probably doesn't spend that much more and gets a more efficient and just quite frankly better quality healthcare.
Love that. Let's talk a little bit about one's niche, shall we? Because
Mhm.
as we mentioned in the intro, it can be a little scary, right? It can be a little frightening because our reaction to niching down, and I definitely can raise my hand here. I fought it every inch of the way in the very beginning of my private practice years. I wanted to help everybody, and there was
Yeah.
no way I could possibly, just the thought of limiting myself was very stressful. And I think that is the way people sometimes feel. It's scary to pick a niche because it feels like we're going to have to turn away clients or patients. So what do you have to say about that? And do you have an example that you can share?
Yes. So first of all, Even if you decide to become a specialist and really kind of do your deep dive, 10,000 plus hours, do our training or other people's training and or our training and other people's training and really become an expert in your niche, plus gaining that clinical experience. You can also, and I even still do occasionally to this day, work with your clients' friends, daughters, parents. Like, you don't have to clinically niche if that's super boring to you. And in fact, there's a way to be sort of a niche generalist if you are really focused on staying local to your community. And that in and of itself, at some level, is a niche in the kind of internet environment that we're living in right now, because people do want to be a little bit more connected to it is a bit of a trend, and people are seeing that as being a larger trend in 2026, that people want to be connected, have some degree of in-person collaboration. And so it is possible to build things like that locally. Even still, though, you're going to grow much faster and much more clearly, because even the people in your community will know who to refer to you if you become as niched down as possible. And I think there's two really important reasons to do that. One is because I really do want you to be like top 1% in the sub niche. Like, you can literally create your own blue ocean. Like, how many people deeply understand long distance running women who are over, who are between ages 35 and 55? And all the common chronic performance, injuries, chronic illnesses, like all the things that they uniquely deal with, compared to, for example, a woman in perimenopause who is bedridden with ME/CFS. Those are two very different populations, and yet they're both perimenopausal women. And if you become clear about the work that you're wanting to do and who you want to help and how you want to help them, it becomes so obvious where your clients are, where your referring collaborators are, where your network should be to help that runner. You could have a great collaborative, not practice even necessarily, but like referral network with a sports psychologist, versus if you're working with perimenopausal women with, relatively severe ME/CFS, you may want to work with, collaboration with a dysautonomia specialist cardiologist. So it begins to help you actually clarify where these people are. And the big fear, as you were saying, Leslie, is that there aren't enough. Well,
Yes, we worry that scarcity that
but the reality is, the number of women transitioning into menopause is like 6,000 per day in the United States alone. So, in your practice, if you have a well designed practice, you might see anywhere from like 30 to 150 clients per year. There are literally millions, if not billions, of these clients that you could access globally when you're very clear on who you help and how you help them.
so even though it feels counterintuitive, the opposite is actually true.
Yeah, absolutely.
And you
Mhm.
become an expert, you become known for a specific thing, which makes you more referable as well, is I think what I heard you say.
For sure. And so it also does work locally as well. But the
Mhm.
other thing that I think is so important about that is you actually become really, really good at what you do,
Yes. Mhm.
because you learn the little nuances, you learn what's common and what's uncommon, the places you need to tweak, and you can keep a beginner's mind with each client, but you already have like a deep pattern awareness of the 80% of what's common across all of these clients.
So good. Well, let's change gears a little bit. And I want to work the topic of AI into our conversation because we know that it really can feel overwhelming to practitioners. So I'm curious if you can comment at all about how you are using it in your practice and, what is the skill practitioners really do need to learn to use it effectively and safely?
Yes. So I strongly recommend against using AI for kind of like being, it could be a little bit of a clinical thought partner if you
Okay.
know what you're doing. But if it's something new that you're exploring, you could use it a bit as a research partner, but it will hallucinate. It will lie. My husband completed a master's in AI and data analytics in like 2017 or 2018.
Okay. He's a
And
pioneer.
so he is. And so we have a lot of conversations around this. And the challenge with these very large language models, the ones that most of us are familiar with, things like ChatGPT and Claude and Perplexity and Grok, by and large, they are designed to please you. So they are going to be really confident about things that are absolutely wrong.
Right? Dead
Or
wrong. Like you read it and you go, sounds great. And then you read it closer and you're like, but wait,
yeah,
totally
or
wrong.
totally wrong, or it will be absolutely confident about things that are sort of right, but
Okay. Ooh, that's a good.
require a lot of nuance, right? And
Uh-huh.
so be very, very careful of that with that. So you can utilize it as a research partner, but you have to become very, very skilled at prompting, which is one of the things we teach in our program.
Okay.
But you also have to be very skilled at helping it, as learning to help it be lie to you less, essentially.
Yes.
Which
Hallucinate less.
even then you have to check its work. So as of right now, it's not going to even replace human researchers because you have to still you become an editor. It kind of helps solve the problem of a completely blank page. But
Yeah.
what it will give you is hundreds of pages, as much content as you want, that you need to then read, edit, verify, double check, you know, refine. It's not complete. And often it's just dead wrong and lying to you. So you have to know that. But if you've written now, like, I've been in this a long time, so have you. So a lot of practitioners and practice owners have years to decades worth of books they've written, blog posts they've written, videos they've recorded, client sessions they've recorded. Like, you don't want to put anyone's medical information into this either. So you have to be really careful of their own data privacy. And in fact, reach out to me if you want to learn this. As of essentially today, I think it's next week technically, Google and Meta have changed some of their rules so they can actually take even any of your own personal information from any email you've ever sent, any DM you've ever sent. They can just take it and train
Whoa.
their AI models with it unless you opt out, which is, of course, hidden really deep in their settings. So that's really important because if you're emailing anything about a client or a patient, Google is reading it unless if you're using Gmail or anything like that, and probably Microsoft is reading it if you're using, Outlook or Teams. I don't know their settings just, off the top of my head, but we have to be really careful of our clients' data. For me, that's a personal value. Like if I wouldn't want to give my own data to Google, I'm not going to give my clients' data to Google. But
Sure.
there are some ways to help you amplify your content so that more people see the stuff you've written by just having AI rewrite it in a way that's like, say, aligned for Instagram as compared to LinkedIn or something like that. So I strongly believe, and I think there's a lot of ways we can use smaller language models. There's a lot of ways we can use this very responsibly. That how we use it to amplify our own creativity and our own thought processes and integrating with other people's ideas can be really valuable. But because we are health companies, I think we also have to be thinking about every time we talk to or write using ChatGPT or Claude, we are causing pollution, environmental pollution, potentially to ourselves or other people, depending on where the data centers are. So I think we have to have an awareness around that because even if we just do more innocuous things like improve our marketing copy or whatever using Claude or ChatGPT, we may be causing physical harm to people who live near data centers. So it's I think a complex question that has I think the place we're at right now, which is challenging because this stuff is moving super fast, is that I think we have a responsibility to understand what these tools are, what they can do, what they can't do. And in order to do that, we have to learn them. We have to learn how to use them. We have to understand what they are. We have to understand what they mean. But we also have to understand that there are significant downsides. So I always recommend anyone who is using these tools to read a book called Empire of AI by Karen Howe and to look at I believe it's called the Center for Humane Technology, which I believe is a nonprofit that looks at essentially how to keep humans in the conversation. So I love from a healthcare perspective, the potential of AI, because I've seen this for years that, especially in chronic illness, there are so many data points that we have to consider. Like we were just talking about this overlap between, say, pain and perimenopause. One woman's case could be wildly different from another woman's case. And because there's so many data points around that, this is something that AI could be really helpful for. Just yesterday, I was listening to an awesome podcast by a guy who essentially solved his own really rare illness by repurposing a medication. And they had to do that pretty manually to just guess like which one of the 4,000 available medications might work, you know.
Okay.
Now we have a tool that can handle the level of data we can get in a really unique circumstance and then look at quickly the 4,000 drugs that exist and be like, hey, could any of these help this, if you will? So I think in healthcare, there's some really exciting potential for certain kinds of AI models. And in fact, we do know that AI is quite good at things like radiology. It can pick up breast cancers, for example, sooner than radiologists. So there's some really important advances, but I think it's our responsibility since these tools they're upon us. We're already like 3 years into the AI revolution. Most people just have never even hardly used them, except maybe go to ChatGPT and being like, "Hey, plan a trip for me," or like,
Right.
help me figure out what my dog is trying to say or whatever. And hey, fine, but how we use these tools is really important. And also, we have to, I think, if we're going to use them, be aware of the dangers and the risks.
So important. So, what happens when you combine niche expertise and AI efficiency? So,
Yeah.
I'm curious about your take on, what that business model would potentially look like.
Right. So the good news there is that most practitioners in these small niche areas, whether they're telehealth and global or their local practices, even if they wanted to hire a team of marketing experts or whatever, they can't. They aren't doing that. They're already doing all their own marketing. They're doing a lot of their front desk stuff. They're doing a lot of their own scheduling, like a lot of the admin. They can't afford to hire someone even if AI didn't exist. So, AI can be really helpful in filling in those gaps so that people who are clinicians can spend less time, not zero time, because we still want your thoughts out in the universe, not generic AI marketing language. But you might cut the time down that you spend writing LinkedIn posts, blog posts, whatever. You can really amplify some of those marketing outreach to more eyeballs utilizing AI strategies. And the same thing with getting admin tasks done that you can't afford to hire a VA for, you could have AI do that. So I think for especially for small solopreneur practices, there is a real benefit. And then you get the word out to more people about your unique niche. Like imagine if you have AI send every Pilates studio in a 50-mile radius, plus every yoga studio, plus every pelvic PT, that you are a nurse practitioner specialized in medical hormone therapies and you would love to speak to their communities. Like you can just amplify how quickly you can get that outreach.
Oh, that's fascinating. So, what would you say is a good, next step or maybe next couple of steps for our practitioners listening today who would like to take action, but maybe they're not quite sure what to do in this direction? What would you say to that?
So, if you're at all interested in perimenopausal niches, we have a workshop, How to Build a Thriving Practice in Perimenopause and Menopause, that you can get for free on our website. If you go to integrativewomenshealthinstitute.com and go to like, I can't remember exactly which part of the navigation on the top, but it's
Okay.
easy to find. Go in and listen to that free workshop. That's where I would begin. You can also follow us on Instagram at Integrative Women's Health. And then, we also have a membership program where we teach, in sort of micro sessions because practitioners are so busy.
Yeah.
We have workshops every week every month where we talk about these things, everything from branding to AI. In fact, we have one next week that is going to be covering using even AI prompting to help you figure out what your niche should be, because a lot of people are stuck just making a decision with that. So I teach you how to use prompting. I show you the difference between the different kinds of tools. And that's a great place to start. Like, what should I even be focusing on? What is my niche?
Okay. So, and for those listening who maybe want a deeper dive training in perhaps an area such, I mean, you mentioned perimenopause, you mentioned menopause.
Mhm.
Um, we want to direct folks to your website as well. Is that correct?
Yeah, I think the webinar is the best place, excuse me, the best place to start at integrative women's health institute.com. You can
Okay.
find in the navigation bar on the very top, you can find we have 3 programs: our perimenopause menopause certificate program, we have an endometriosis certificate program, and we also have that membership for people who just want kind of bite-sized learning at a much lower cost. We have the free workshop on the navigation bar, and we also have a link to our podcast where
Ooh.
we talk about these things every week. We're almost at our 100th episode. So that's a big celebration. So there's plenty to listen to if you want to just, explore some options for you when it comes to niching and see what some of our successful graduates are up to now. I think those stories are among the most exciting, inspiring when it comes to, listening to the podcast.
Okay. I love that. Yeah, and in our prior conversations, you and I, well, and you already mentioned this, just the number of women. I think you said 6,000 a
Every
day. Did I
day,
hear that
6,000
right?
every,
Okay,
yeah,
6,000 a
6,000 a day.
day entering the world of menopause. That's
100%.
huge.
I
That is
know.
insane. Okay.
And many of them are really looking for healthcare.
Need support.
So, yes.
So, yeah, women's health, definitely a good place to hang your shingle, and specifically around perimenopause, menopause, and even adding more specificity under those, areas of specialization,
Yeah.
like your examples. Okay, love that. All right. Any final words of wisdom that you'd like to share with our audience today?
I don't think so. Just go, listen to the podcast,
Yeah.
follow us on Instagram, and just know that it might feel to you like the perimenopause, menopause needs just saturated because there's a lot of conversation on social media. But that conversation has sparked people looking for practitioners, not just the educators that they follow on Instagram. So the market is wide open for you. It's not at all saturated. In fact, it's really
Okay.
underserved. Yeah.
That's so important. I get that question a lot. Like, oh my gosh, I see so many people in, this certain niche.
Yeah.
But it's clearly just a huge opportunity in women's health, especially those couple of areas that we talked about, perimenopause and menopause.
Yeah.
So awesome. Okay. Well, Jessica, thank you so very much for such an insightful and frankly empowering conversation and your clarity on what practitioners really need right now is exactly what so many have been asking for. So thank you for that. And for those of you who tuned in, thanks for joining us. Just a quick reminder, Jessica has really a fantastic free resource. It's an on-demand training, as she mentioned, and it is entitled How to Build a Thriving Perimenopause and Menopause Health Coaching Practice. And you can watch that. Actually, I have a bit.ly link if you'd like to go that route. It's bit.ly/CEO dash IWHI. All right. So you can grab that resource right there on the spot. And I think it's a really great next step if you would like to deepen your expertise, again, in one of the fastest growing areas of women's health while building a more scalable and future ready practice for yourself. So, thanks again, Jessica, for joining me. I appreciate you sharing your time and your expertise. And thanks for all of you who watched and tuned in today. And I look forward to seeing you next time. Bye for now.